Hi and good morning, everybody, and welcome to my desk. So, I thought we could have a bit of a coffee clock this morning because I've been hearing a lot, especially on TikTok, about the Canadian medical system. Now, I live here in Winnipeg, Manitoba, and generally I'm very healthy, and so is my partner. So, I mean, generally we don't have a great deal of a reason to go to a doctor or anything like that. Now, warning, this might be a little triggering for some of you. I'm just going to lay it out there for everybody so that, and I'll give you the story behind why I'm saying this. So, about, I'd say 6 months ago, my partner came down with an illness, cough, cold like symptoms, flu like symptoms. And so we were a little concerned. It had gone on for the better part of probably 2 weeks, I would say, before we thought, you know what, we need to get you to a doctor. You're just not getting any better, and it looks like, in fact, you're getting worse. So, yeah. And he's an older gentleman with asthma, so I'll just add that he did have a pre existing medical condition to which he has inhalers for. And so, yeah, we decided after a couple of weeks we're gonna get you to the doctor. We're gonna get you looked at and see what's going on with you. You're not breathing correctly. You know, things are going from bad to worse. And so we take him in first because one morning he wakes up and it's got to be like 2 o'clock in the morning. And we have a semi emergency at the Victoria here in Winnipeg, and that's off of Pem. So, okay, we'll go there. Probably the best bet at this point to get you treated or something of that nature. We go in there, 2 o'clock in the morning, and we literally wait for probably about 4 hours. Now, he's already seen the triage nurse. They know he's there. They've done his blood pressure and that once already. And so at about hour 4, we decide we're going to ask the nurse, like, how much longer are we going to have to wait to be able to see a doctor? I mean, we understand that there are long waits. That is just the general norm of things around here. And she tells us, oh, well, maybe 17 hours, 18 hours from now, after being there for 4 hours already, you might be able to see a doctor. Okay. That's a wait and a half. Okay, so we're not going to do that. He decides, okay, I'm not sitting here for 18 hours from after sitting here for 4 already. I'm getting hungry. I'm getting tired. I just want to try and get some rest. Can we just go home and we'll work it out in the morning? Okay. So I knew he wasn't feeling well. I knew that, yes, I'll take him home and, try and make him comfortable for the rest of the night and maybe see a doctor tomorrow. So we did this. We went home and I made him comfortable. He got a few hours rest. He got up, said, I'm not feeling great. Like, I'm just not feeling great. He's like, maybe I should just go see my doctor at the walk-in and see if I can get some help from her. Okay. So he goes off and, he goes and sees or tries to, and I will say try, and I still don't understand how a man walks into a doctor's office and says he's having trouble breathing, he's been sick for more than 2 weeks, he's in his late 50s, has asthma, and the doctor refuses to see him. Nobody in the waiting room. She's got, even the reception is wondering what's going on. And my partner leaves without being seen. Still sick. And this woman just basically refuses to see him. And that I found a little unacceptable, but whatever. So he comes back and he tells me the story, and he's upset, of course. And I say to him, okay, look, I'm going to phone Health Links, because we have that here. We can phone Health Links, and the medical professionals will help you as best they can. And I have to admit that thank God for Health Links here in Winnipeg, because had it not been for them, my partner might have died during this whole thing. And hey, Canada, Winnipeg, Manitoba. Okay. Right now, from where I'm sitting, and even after just that first portion of the story, and I say first portion because it turns out it goes on. Um, I'm gonna tell you, we don't have a medical system here in Manitoba. When we have doctors refusing to see patients that had nothing going on in her office, and we can't get to see a doctor for more than 20 hours in a waiting room in emergency or even a semi emergency system. There's no medical system here. In fact, it was a walk in doctor, which I'll get to at the end of all this, that helped me with Health Links get my partner back to working order. Okay. So that's what we're living in. Now, so it goes on in any event. So things aren't getting any better. He's not getting any better. He goes back, he catches another walk-in doctor who basically gives him a 3-second look over, doesn't do any tests, take any blood, just look, yeah, that's COVID, here's some medication, see ya. So he comes home with COVID medication. And he's like, yeah, the doctor just said I had COVID and gave me this medication and I'm just supposed to take it. Oh, okay. Well, do you have COVID? Oh, I don't know. He didn't do any tests. He just wrote me this prescription and told me this is what I have and to take it. Oh, well, all right. We'll see how that works. Within 24 hours of being prescribed medication for COVID, my partner went from being, not great, but to really, really bad. Like, and I mean in the snap of a hat. Because he didn't have COVID. So, taking medication for something you don't have will actually exasperate, and this is what's going on. So, okay, he ends up going from bad to worse, and I think, oh boy, here we go. This is just going to go downhill from here, because, he's just not getting it, but he's getting worse. And we're going into 3.5 weeks in. And I'm getting more worried by the day. And I'm not getting any sleep because I got to be up making sure he's still breathing, make sure he's not choking on his own fluids, and this medication isn't working, and I'm trying to help him with over the counter, and I'm calling Health Links to make sure that I'm not slowly poisoning him by crossing medication with over the counter stuff, because let's be real, when administering any medication, whether it be prescribed or over the counter or a combination, you need to be aware of what you're giving somebody or what they're taking. So, again, he's on this medication, it's going from bad to worse. So I phoned Health Links and they're like, hey, well, he doesn't have COVID, it's obvious, because it'd be making him better, not worse. So, don't take that medication any further, go back to the doctor and get some help. Okay? Because he's already, 3 days, no rest at this point. I'm noticing a purpley tinge under his fingernails, which Health Links is telling me that this is a sign of he's not getting enough oxygen and all of this. Okay, so we got to go to a hospital because what else are we doing? You're not breathing we need to get you looked at. I take him over to St. Boniface. And the waiting room is insane. It is so full in there, it's not even funny. And there's security at the door that, it looks like something, and you gotta be there to see it, in all honesty. And I get there was construction going around the entrance at that point, but it looked like something out of almost a war-torn film walking in there. There are people scattered everywhere, sick laying in the hallways, like doctors and nurses running from one end direction to the other. And triage so full and packed that they have 3 stages of entrance. You see the first lady check in, you see the second lady get your vitals checked, you see the third lady and she starts directing you towards, medical things, like tests you may need before you see the doctor. And at this point, I'm like, okay, well, at least something's being done, but, still, we're sitting in a waiting room with a ton of other sick people, and it's just, it was an ordeal. And at that point, we were both sleep deprived. He was sicker than a dog. I was starting to feel fatigued and ill, and I'm trying to fight it. He's trying to fight. He's doing a horrible job. He's not fighting it. And, so here we are at St. B searching medical help for a patient that may be dying. I don't know. I'm not a doctor. I'm just trying to keep this guy alive. Okay? And nurse tells me, well, I'm sorry, it's going to be, probably 29 hours before you're going to get seen by a doctor. And I looked at her and I went, lady, 29 hours? He might be dead sitting in your waiting room by then. And she looked at me and she said, well, that's our medical system, sorry. And, well, you do have a choice, though. She's like, he could either sit in the waiting room, wait the 29 hours, and he might live, might not. No. Or you could take him home and he may expire at home. Don't know. Let me know what you want. These are now our options here. Okay? So, I don't know what to tell people. I don't know what to say to Canadians. I mean, us as a whole, we have to agree that we actually don't have a functioning medical system. We do not have doctors that we can see. Even if we want to go see these doctors, even if we go to these services to seek medical attention, if you are close to expiring and you try and go for emergency medical assistance in the emergency room without an ambulance, the likelihood is, from what I've seen, is you're going to probably expire in the waiting room, on the floor, with everybody else. So, in true old-fashioned form, I'm going to say to everybody, it's time for us to go back to the way things were when women and families knew how to take care of each other. How to deal with infections, how to deal with colds, how to deal with flus, how to deal with any of these things that and I get it, they've mutated. They've changed. It's not like cold from, and I get that. There are a lot of scary things out there. But we don't have a medical system that will help us fight these things anymore because it's so stressed and so overwhelmed that people are laying in stretchers in our hallways in hospitals dying, waiting 29 hours, if you're lucky, to see somebody. So, again, I know I'm probably going to get a lot of hate for this, and maybe not. Maybe some of you know what I'm saying. Maybe there are enough of you out there that have experienced just that you agree that it is now time for us to learn how to take care of each other. Now, our grandparents did it. My grandparents did it. Okay, Gen X, we survived things. And we will survive this as well. So it is time for us to learn how to deal with cuts and scrapes, deal with bumped knees, deal with some colds and some flus, and, hey, maybe a mustard pack wouldn't kill us again. Just saying. Good old-fashioned steam, good old-fashioned Vicks, good old-fashioned, chicken noodle soup. That's basically what it's boiling down to for us. Because, go ahead, go to emergency services. And good luck to you with that. Realistically. And I hate to say it like that, but no, not sugarcoating it, sorry. I mean, it is what it is. What do you want? That's just sort of what we're left with. So after the decision was made, yet again, in another emergency service where we're not getting seen, we leave. And we come back, and I say to him, look, there's another walk-in clinic just around the corner from here. It's on the opposite side of the street. We live in St. Vital. So it's on the opposite side of the street from your other clinic, the one that, you know, didn't have the time to see him. And maybe we can get some help there, because Lord, something's got to happen, okay? So we go over there, and thank goodness the most wonderful doctor, Dr. Campbell, who is a walk-in physician at this clinic, had enough time to see him, and thank goodness had enough time to realize that no, he didn't have COVID. It was actually influenza virus. Got some good antibiotics, got some good care, and was finally back on the mend after a month of fighting. So, again, I say to you, it's time as Canadians we learn how to take care of ourselves again. There was a time, my generation, we didn't go to the doctor for every little bump, scrape, bruise, knee. No. You rubbed dirt on it and you moved along. A lot of times if you got hurt, they told you, suck it up, buttercup. Was what it was. So, you know, I'm just going to say that unfortunately this is the truth of what we're living with. And, you know, and maybe I can hear from some of you Canadians out there too, like, how many of you are experiencing that exact same kind of treatment where you are? Like, I know here in Winnipeg, Manitoba, that's what I experienced with my partner. And again, I'm grateful that, you know, thanks to HealthLinks and thanks to that one walk-in that we were finally able to get some help at, that we were able to get him back to good. And he's been fine, you know, back to work, working his good old self as always. But, you know, it took a month. Took a month of fighting and trying, you know, over-the-counter stuff and calling HealthLinks and trying to get in to see somebody to get him finally looked at and back to normal. So I want to hear from all of you out there. Tell me, are you experiencing those sorts of medical issues in your community? And yeah, let's talk about it a little bit, because I think we need to come up with a better plan than, fingers crossed, hopefully we can see a doctor at the medical. You know what I'm saying? Anyway, that's my coffee cluck for today with you all, and thank you so much for joining in and stopping by, and I look forward to hearing and seeing from everybody, and stay tuned. And don't forget to hit subscribe and like, and hey, for my algorithm, drop a comment. Let me know where you're from, what you're doing, what you're at, and what your situation is over there with your doctors and that. And if you don't know what to say, just say hi, or simply watched. Until next time, everybody, thank you so much, and have a good day. Bye!